Welcome to Science Easy Tech channel, Nursing Made Easy. In this video, we are going to discuss about causes and risk factors of illness. In my previous videos, I have given health definition and concept of health as well as factors affecting health. So you can watch my part 1 and part 2 video I have given in the end box or in the icons as well as in the description box. You can go and have a look into those videos, or you can watch our channel playlist for more nursing related videos. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Let's move on to the thing what we are going to discuss in this video. So already I have told the topic is causes and risk factors of illness. So what is illness? So what is mean by illness? Illness is any disease or deviation in the normal functioning of the body. So it can be a disease or it can be any deviation from the normal functioning of the body and how the person is going to respond to the disease. So illness is any disease or any deviation in the normal functioning of the body and the way the person responds to the disease. Let's see the causes of illness one by one. So we have so many causes of illness. So let's see what are all the causes. Biological cause, psychological cause, physical cause, hereditary cause, traumatic cause, idiopathic cause, nosocomial cause, iatrogenic cause, neoplastic cause and congenital cause. So let's see one by one. Biological cause. Biological means it is due to any infection due to any pathological microorganisms. The pathological microorganisms are nothing but the microorganisms which can produce a pathology in the body, that is a disease in the body. So the microorganism can be either bacteria, virus, fungi or protozoal, whatever it may be. Next is psychological. Psychological, nowadays more than physical illnesses, many are suffering from depression, stress, anxiety. They are not able to control their emotions. So psychological illness occurs due to stress, anxiety, tension, fear, lack of control of emotions, etc. Next, physical. So physical means it can be due to extremes of heat and cold, too much of heat or too less heat, or too much of cold, radiation, air pollution, noise pollution, like that and all. Okay, so that comes under physical cause. Next, moving on to the hereditary cause. Hereditary means, okay, it is transmitted from one generation to another generation because of genetic influences, due to genes transmitted from one generation to another. For example, from parents to their offsprings or children. Next, to traumatic. Traumatic means, trauma means injury. This traumatic can be due to accidents, falls, injuries, assaults, etc. Idiopathic. For some disease, we may not know what is the reason for the occurrence of the disease. The cause is not known. So that if the cause is not known, then it is called as idiopathic. So we have seen biological cause, psychological cause, physical cause, hereditary cause. Example is like diabetes, okay, sometimes cancer, okay, traumatic causes and idiopathic causes. Let's see other causes also. Nosocomial cause. Nosocomial means hospital borne or hospital acquired infection. Okay, so the infection which occurs in the hospital, the cause is from the hospital, the illness is from the hospital. Next is iatrogenic cause. The illness is due to any treatment procedures which you are performing in hospital. It can be any surgical procedure or it can be any wrong procedures what you have performed during surgery or during any diagnostic procedure. So the illness which occurs as a result of a complication of surgery or a complication of any diagnostic procedures or any therapeutic procedures. So iatrogenic cause means illness due to any treatment or procedure related causes which occurs in hospital. Next, neoplastic causes. Neoplastic causes, it is due to extremes of radiation, that is harmful radiation, or any chemicals or any harmful substances, that is neoplastic cause, which can produce any changes in the cells. Okay, next, congenital cause. Congenital means during the formation of fetus in the womb, in the mother's uterus. During the development of the fetus. Fetus means the child which is present inside the womb. Okay, so that time if there is going to be any malformation, okay, by birth itself, suppose if the child is going to have either a cleft lip or a cleft palate, or the child is going to have short extremities, or the child is going to have short head, like this, so many congenital conditions are there. Okay, so that arises because of any malformation or any disturbance in the child's development in the womb, that is in the fetus development in the womb. So that is called as congenital cause. So we have seen so many causes like biological cause, psychological cause, physical cause, hereditary cause, traumatic cause, idiopathic cause, nosocomial cause, iatrogenic cause, neoplastic cause, and congenital cause. So let's see some community related causes. So the outbreak of a disease can be classified into three types, that is epidemic, endemic, pandemic, and sporadic. In a community you can list under these steps various diseases: epidemic, endemic, pandemic, and sporadic. So epidemic means it is a sudden outbreak of a disease. For example, sudden outbreak of cholera, okay, and or Ebola virus outbreak, then SARS infection, like that. Okay, so initially COVID also we have told that's an epidemic, but as it spreads, epidemic in China, but as it spreads to the whole world, it becomes a pandemic. Okay, so next is endemic. Endemic means some disease are always present in the community. For example, typhoid fever, TB, malaria. So these diseases, diabetes, these and all will be always present in the community. So that is called as endemic diseases. Next is pandemic. Pandemic means the best example is what we are facing now is corona, COVID virus infection, COVID-19. Sudden outbreak of a disease, it affects the whole world. It touched each and nook and corners of the world. So whole world got affected by means of the disease. Then such a disease is called as pandemic. The very good example is COVID-19 infection. Next is sporadic. Some diseases which occur in only some areas at a particular period of time. Okay, some diseases will occur at a some period of time, that is geographical area, at a particular season. Example is dengue fever. So these are the causes for illness. Let's move on to the risk factors of illness. So under risk factors you have family history, age, sex, gender, race, ethnicity, geographical living area, lifestyle habits. So family history, I already told, suppose if the parents are diabetic, the chances of the children getting diabetic is also more. If the parents have cancer, the chances of children getting cancer is also more. So some diseases you will have your family history like bronchial asthma, diabetes, cancer, like that and all. Next, age. Some diseases are very particular to children. Okay, rotavirus infection, like that and all. Some diseases are very particular to old age people. Some disease affects adolescents, like that. So depending on the age and the developmental stage what you are, so your immunity, everything will be varying. So you may be more prone for diseases. For example, children are more prone for disease, as well as the elderly people are more prone for diseases because of lack of immunity. Next is sex. Some diseases are more in males. Some diseases are more in females. For example, hypothyroidism is more in females, whereas heart diseases, okay, heart failure, heart attacks are more in males. Next, next is race or ethnicity. So based on your race, ethnicity, the geographical region where you are living, everything, okay, will affect some diseases. Okay, for example, Africans and all, no, they are more prone for some diseases like hypertension, like that and all. Okay, which is more prevalent in some particular race group, or like Africans, okay, or black Americans, like that and all. Okay, geographical area of living, the persons who are living in hilly areas and all, no, they are more prone for goiter and all, like that. So the geographical area, see here in India we are not having Japanese encephalitis, like that and all, but when you go to abroad, they are asking whether you have been immunized for JE, that is Japanese encephalitis infection, and so which is more common in the particular area. So they are asking you to get immunized and to go to that particular area. So depending on the area also, for swine flu like that and all, so many flus they are telling, which are common more in western countries or America like that and all. So lifestyle no, habits, your habits, if you are going to have good habits, it is going to improve your health. Suppose if you are going to have bad habits like smoking, alcoholism, bitter leaf chewing, ganja, whatever it may be, so it is going to deleteriously affect your health. Next is sedentary lifestyle. Sedentary lifestyle means not doing any work, always sitting and relaxing, lazy, physical inactivity. Everything is going to lead to what? Put on your weight and obesity, which is going to be again an aggravating factor for many of the disease conditions. Okay, diet or nutrition plays a very important role in ancient days and all. What they have told, food is the best medicine. If you are taking your food properly, and if you are going to have your diet regularly and according to the local area where you are living, so that local food items if you are going to take, so that is the best medicine which will give strength and stamina to you, and it will gives immunity to you. So proper dietary habits. But now what we are taking, we are eating so much of junk foods, okay, carbonated beverages like that and all, we are taking so much of thing, and it is spoiling your health. Next is physical inactivity. This is more or less related to sedentary lifestyle, not doing any exercise, anything. So physical activity, exercise is very important. Okay, so if you are going to be physically inactive, again it is going to have a deleterious effect on your health. Your cultural values, your personal beliefs, your religious practices, all are going to affect your health. Okay, your illness, the way how you are going to approach to the medical team when you are going to have a illness, everything is going to affect the thing. For example, for jaundice, even in today, many are keeping fire, okay, fire on the hands, thinking that if they are going to keep fire on the thing, the jaundice is going to, hepatitis A, mainly hepatitis A is going to go off. But these are all what some religious cultural practices, what they are doing. So without any particular reason, nowadays I have seen by a case, rabies. For rabies, they have not undergone vaccination. So a dog has bite an individual, but the individual has taken some country medicine, okay, just he has not taken rabies vaccination, and finally he developed rabies and he died in front of our eyes in our hospital. So which is very pathetic. So still the people are not aware of seeking medical help. So they are following some traditional practices are really very good, but some practices you have to consider, because nowadays it's not like olden days. We are having so many, more than 1,000 diseases we are having. So for each and everything we are having specialized doctors, everyone. So but still people are having lack of knowledge and awareness about the existing healthcare practices. So these are the risk factors of illness, whatever I have told: family history, age, sex or gender, race or ethnicity, geographical area of living, and lifestyle habits. Under lifestyle habits you have habits, sedentary lifestyle or physical inactivity, diet or nutrition, cultural beliefs, values, religious practices, etc. So hope this video is clear for you all. If you like my video, please give a thumbs up, share and subscribe to Science Easy Tech channel. My previous videos link I have given in description box. Please go and watch it. Keep supporting to Science Easy Tech channel. Thank you friends.